we see in many textbooks that same oil is referred with different same name but slightly different formulas in different conditions. For example, Balataila is explained in Vata Vyadhi and also in Vata Rakta Adhikara. So what is the difference between these oils which are explained in different contexts?
Yes. Here lies the importance of classical Ayurvedic literatures. One particular formulation which is referred in one particular adhikara, that is particular context. For example, you have correctly quoted Balataila of Sandhivata, Vata adhikara. That can be used even in Vatarakta cases also, gouty arthritis cases also. But the Balataila which is referred in gouty arthritis cases especially, it is containing more of the snigdha dravyas like kshira, milk, yastimadu, glycyrrhizia glabra, or ashwagandha, or sariva, Hebbarjv indicus, vidari, shatavari, etc. ingredients. Whereas such ingredients will be comparatively lesser in case of the Balataila which is referred in Vata Adhikara, because in the Balataila which is indicated in Vata Adhikara concentrates more towards the mere Vata pacification or otherwise Vata Kapha pacification, whereas the Balataila which is referred in Vata Rakta Adhikara concentrates more towards the pacification of Vata and Pitta together. So both are referred as Balataila only because Bala is the main ingredient in both the formulations. Depending upon the nature and utility and the individual's constitution, Prakriti, we can prescribe here and there. The Balataila which is referred in Vata Adhikara can be used even in Vatarakta also. Or the Balataila referred in Vatarakta can be used in the Vata Adhikara also. But if the Balataila which is referred in Vatarakta Adhikara, it is used in Vatarakta only, we can get more benefit out of it. But in the market, usually people will be confused, and by the time when the physicians prescribe Balataila, it will be always better to ask to specify the context. Balataila of Vata Rakta Adhikara, Balataila of the Vata Vyadhi Adhikara, etc. Otherwise people will be confused. And secondly, how to know it? For that, very easy method is, after bringing the preparation or after seeing the preparation, better to refer the reference. There it is exactly written whether it is Vata Rakta Adhikara or Vata Vyadhi Adhikara or any other Adhikara with respect to Balataila. Similar preparations we can find even with respect to Lehyas also, because Shatavari Lehya is there, Shatavari Leha is there, Shatavari Rasayana is there. Shatavari Rasayana usually contains the sugar candy, whereas Shatavari Guda contains jaggery. Both are used here and there. Both will help in the promotion of the breast milk because both are acting as galactogogues. But if Shatavari Guda is administered, the iron deficiency persisting in the lactating mother can be pacified in a better manner, whereas that effect will be comparatively less if Shatavari Lehya is prescribed, where sugar candy is used as a base. These are the quite simple examples. In Ayurvedic literatures, we are getting the reference of Amalaka Rasayana. Amalaka Rasayana is quoted in more than 14 references in altogether Ayurvedic literatures. But better to refer in which context, that is called as Adhikara, which context exactly that formulation is referred. In the name Dashamula Taila, we are getting 5 to 6 references. But Dashamula Taila exactly which referred in which context, that is very important. I can quote several such examples. Kutajarishta is there. Kutajarishta is usually used in case of the treatment of diarrhea or dysentery. But Kutajarishta can be judicially used even fever also. We should refer under which context that is mentioned and with what are the ingredients. Depending upon the context, even though name is same, there will be change in the number of ingredients.